Time now for the Spine Doc, putting you on the road to better spine health, featuring Dr. Pasquale Montesano, MD, world-renowned orthopedic surgeon and spine and joint treatment specialist at Montesano Spine & Sport, with offices in Palm Beach Gardens, Miami, and Naples. Dr. Montesano is a pioneer in the development and application of the revolutionary A2M treatment for lasting proven relief of chronic pain and discomfort in joints. Now, here's your host, Brian Content.
Hello, and welcome again to the Spine Doc, on the road to better spine health with Dr. Pasquale Montesano, MD of Montesano Spine & Sport, with offices in Palm Beach Gardens, Miami, Naples, San Juan Capistrano, California, soon to be in Las Vegas, and in Rome, Italy. Dr. Montesano, great to have you here again. Let's talk about spine health, good spine health, and how we can get to that plateau, because I know the rigors of athletics, day-to-day living, lots of things affecting your health originate with good spine health or poor spine health initially, and getting that major organ, if you want to call it that, correct is, I guess, a key to good living overall.
That's right, Brian. I think, the spine is really the organ that allows you to be erect, allows you to have good posture, and allows your chest cavity to function properly, your abdominal cavity. So it really, good spine health is really the key to good health in general, because it allows all your organs to function properly, and vice versa. There's nothing really about good spine health that wouldn't also apply to health in general.
Mm-hmm. And just so people know, because we're going to give you a lot of information about Montesano Spine & Sport, because Dr. Montesano is one of the foremost experts in spine health, and starting off as a trauma surgeon, one of the world-renowned spinal trauma surgeons, and has certainly progressed over time to other aspects of spine health other than surgery. And we've talked about this on previous shows, kind of a top-down approach where you have been to the pinnacle of dealing with people who have had severe injuries to their spine. And, well, I'll let you take it from there.
Well, Brian, when I started in spine surgery, which was in the mid-'80s, there were a lot of things that we weren't doing in the United States. And so my chief at the University of Kansas sent me to Europe, to Switzerland in particular, and to Sweden, where I learned some of the techniques that had emerged from those countries, such as odontoid screw fixation. The odontoid is part of the second cervical vertebra, cervical spine fixation in general, as well as fixation of the entire spine. When I use the word fixation, I mean to stabilize using materials. At that time it was 316L stainless steel. We still use stainless steel, but now we also incorporate other metals, titanium, cobalt, chrome, and we also incorporate other materials besides metals, carbon, and a material called PEEK, polyether ether ketone. But the important thing, Brian, is that there's been an evolution in the treatment of spine problems. I was one of the first people to go over to Europe to learn these techniques, and then I brought them back to the University of California, Davis, and I was probably the first person west of Mississippi to ever put an odontoid screw in, or screws in C1, C2, the first and second cervical vertebra, screws in the occiput, and probably was one of the first half a dozen people to ever put screws in the pedicle in this country. So we started out at an early point in time, and we're able to see the evolution of different treatments and how they've come about, all aimed at stabilizing a spine that had been traumatized to the degree that the person could no longer stand erect, that they had to either lie in bed or lie in traction. So it was an evolution from that type of a treatment, from what we call the forced supine position, to being able to have the person stand upright and recover in a proper manner from their injury.
Now, this is, I guess, a trial and error over time before these techniques could be perfected, I suppose, and using different materials over time, finding that some materials work better or new materials are developed which find they have a better outcome?
Absolutely. There was a slow evolution in what materials to use.
If you've just tuned in, you are listening to The Spine Doc, Dr. Pasquale Montesano of Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, Naples, San Juan Capistrano, California, Rome, Italy, and soon to be in Las Vegas. To contact Dr. Montesano's office, give him a call at 866-79-DR-SPINE. That's 866-79-DR-SPINE, or visit him at his website, spinedocs.org, spinedocs.org. All the information you need about Dr. Montesano's training, about his practice, about his treatments, you can find on there. And let me tell you, Dr. Montesano's training has got to be second to few in the world, because just reading his CV, some of the accolades, he's truly, well, I understand with your training at UC Davis with the spine trauma, but I mean, you're a New York guy. You started off your medical training in Siena College and New York Medical College.
That's correct, Brian.
Tell me a little bit more about your background.
Well, I guess my background starts even in terms of how I got interested in spines before college, because my mother had become paralyzed at a young age. And so I think it was that fact that stimulated me to want to go into spine. And from there, I had to get the proper training. So obviously I had to become a physician. I had to go to medical school, become an orthopedic surgeon. And then following that, I did what's called a fellowship. I did 2 fellowships, one at the University of Kansas. And then following that, I went to Europe, because at the time, once again, we were in the mid-'80s, and we had fallen behind here in this country in terms of what we weren't doing. So I went to Europe and learned a lot of the techniques that had developed there, had developed in Switzerland and in Austria and in Germany and northern Italy. And then I took those procedures that I learned back to the United States, and in particular the University of California, Davis, and where they have a very big trauma program, and in particular one of the largest spine trauma programs, only because they've got 3 or 4 major highways that intersect right in Sacramento, where the university is. And it's unique in another aspect that there's 2 clean rivers that run through it, so there's a lot of recreation on the rivers. And rivers can be a very dangerous body of water to recreate in, because the bottom of the river changes every day. So where you might have been able to dive today, you may not be able to dive tomorrow, because overnight a log may have moved into a different position, and so you go to dive in that position, and you hit your head and end up with a cervical spine injury. Mm-hmm. So that's one thing that I always caution people about. Be careful with rivers, because you can never be comfortable with a spot, because the spots change all the time. They're very, very dynamic. But that was part of my training, because as a professor at UC Davis, we had to treat a lot of it. And half the population of San Francisco travels up to Lake Tahoe, on Friday, and then they have to come back on Sunday. So there were a lot of there just were a lot of reasons that people ended up with spine trauma. Mm-hmm.
And I don't want to embarrass you and go down the list of accolades and so forth, but you ongoing training, you're published many books, many articles, research, consultation. You are considered one of the top experts in your field as a result of your prior training, your training overseas, and bringing back some of those, innovative techniques that were being only used in Europe, and now, finding their way into the mainstream, I suppose, in the U.S.
Well, yes, I think they've achieved that goal. They have found their way into the mainstream. But not only was my career taking a path of surgical options, I also was part of a team of 3 people that developed a wellness center. I mean, that term gets overutilized, and anybody that has an 800-foot square foot office calls themselves a wellness center, but we have a real wellness center in California, and it's in Roseville, which is one of the suburbs of Sacramento, and it's called the Roseville Health and Wellness Center. It's about 40,000 square feet, fitness facility. We have on-site, chiropractic, massage therapy, physical therapy. There's physicians on site almost constantly there, and we have an indoor heated saltwater pool that helps with rehabilitation, and we've been honored by being awarded the number one wellness center in the United States. Part of that was because that we went out and got all of our programs certified. So we have cardiac programs there for people that have had heart problems that are certified by the American Heart Association. Some of the people on staff, in fact, had various illnesses. One of the people on staff there had diabetes, and so we went out and found out what the American Diabetes Association was doing in terms of exercise and adopted their programs and down the list. And it's something I'm quite proud of. And we have the absolute top of the line exercise equipment in the world is made by Techno, and we have not all, but we have a good portion of our equipment is Techno equipment, very easy on the joints, fun to work with. And we have a lot of world-class athletes that train there. Don't feel comfortable mentioning names, but one of our athletes made it to the final list looking at the Heisman Trophy. So very proud of the people that have developed the facility, and very proud of the people that train there, the athletes that train there.
I assume that you probably would be thinking in terms of, wouldn't it be great to have a Rosewood in other parts of the U.S., or is it something that is so specialized that you would bring people to that facility?
Well, first off, Brian, it's Roseville.
I'm sorry.
It's Roseville, right? It's outside of Sacramento, one of the suburbs there. Well, early on we thought about doing that, but I think that it's the individuals. It's not the building, but it's the individuals that we have there that it's hard to duplicate. And there are a number of gyms, and most of my partners get furious if I use the word gym because they don't want me to compare, and I don't want myself to compare our facility to a gym because we're not. We're program oriented. So if you've got a problem, if you've got a goal, a need, a desire, then you come to us with that need, and we develop a real world-class program for you, and the results that we've had are just outstanding. We've had a lot of champions train there in terms of a variety of different sports. We've had high school teams train there that have gotten state recognition, and in California that's a pretty significant thing considering the size of the state. And in terms of the people with the citizens of that community that have had a wide variety of medical issues, all of the programs are geared towards what that particular issue is that they have.
Now, you don't just preach about this good fitness. You are also a very physically fit martial artist, highly trained athlete yourself.
Well, I try. Actually, I probably shouldn't use that word. I try to avoid using that word, and there I don't allow my daughter, my 13-year-old daughter, to use that term. And it's funny because she was training. She trains in the whole self-defense circle, the fight circle. They say there's 5 elements of the fight. There's the philosophy of what to do, when to do, and how to do it. So philosophy is one element. Throwing techniques, the surprise attack techniques. There are striking techniques, and then there's the ground fighting. and from a young age, I've had my daughter go around and train with some of the best. And her striking, she's trained locally here with Christina Huang, who has a wonderful Taekwondo school over on PGA. And in striking and ground and throwing, she's trained with Gaetano Scuderi, who's probably one of the world's greatest hand-to-hand combat instructors, besides being a top-notch spine surgeon, world-renowned from Stanford University, who practices and works and trains in Jupiter and has a wonderful martial arts school there. But she was training with one of her throwing coaches over the weekend, and the coach said, "Now, I don't want you to try, I just want you to do this." And then he stopped and he said, "Who said there is no try? There's do or don't do?" And she looked at him square in the face and she said, "Yoda." and he was shocked that was the answer, and she knew the answer because he clearly wasn't thinking that she was going to come up with the answer. But she has a little poster in her room that I put there that, it says exactly that there is no try. There's do or don't do. You don't try at anything. You either do it or you don't do it.
That's right. Well, that's certainly useful information when you're trying to rehab from a traumatic injury or just an issue with a joint problem, or after you've undergone treatment. I know the old adage, "No pain, no gain." I suppose is part of that, because if you're not feeling it, you're not working hard enough.
I think that's correct, Brian. I mean, you have to use common sense, you have to use good judgment, but I think there's a lot of truth to that.
Well, speaking of athletes, you have a patient who is going to be joining us on the phone here to talk a little bit about the treatment he had with you. Dr. Montesano, I'm going to let you take it from here.
Marcel, how are you doing today?
I'm doing great. Thanks for the opportunity to talk.
Fantastic.
Spread the words.
Marcel, you're from Brazil originally. You're from up in the mountains. Now, what does Brazil border with there? Is that with the border?
I'm from the Pantanal. There's a nice, actually, Discovery Channel episode about my region in Brazil. It's just like the Everglades, with mountains, this border with Paraguay and Bolivia.
Is that where the Amazon starts?
It's not part of the Amazon.
Let me ask you, you're a world champion, is that right? What was the championship that you won in jiu-jitsu?
My biggest accomplishment in jiu-jitsu was win 3 of the absolute divisions for the Abu Dhabi Trial Pro, which is you only able to compete at the World's Abu Dhabi Pro if you win the trial. So I won 3 absolute divisions. Absolute divisions is when you compete with no weight limit. So I'm a lightweight, and I competed against heavyweight.
How much do you weigh, Marcel? What is your weight?
I'm fluctuating between 175 and 180.
And what was the biggest guy you fought in that division?
I fought 300-pound guys before.
Wow. So listen, how long did you have neck pain for before we met one another?
I have neck pain for so long, it's even hard to remember. I was shot out for around 5 years. But since I remember training jiu-jitsu, I remember having neck pain.
Now, you had multi-level herniated discs in your neck, and you came to me. A number of people had told you that you should consider a disc replacement, but I told you we needed to take more of a non-operative approach first, and then I remember telling you if that approach failed, that I didn't think for a fighter that a disc replacement was a good option. Normally, if somebody does contact sports, we recommend a fusion rather than a disc replacement. But we didn't have to get to that point because we treated you with a biologic treatment called alpha-2 macroglobulin, which was developed out of Stanford University. Tell the listeners a little bit about that experience with that biologic. And it is the only scientifically proven biologic that's available to patients. What was your experience, Marcel?
First of all, I would like to thank you here in front of everyone, for everyone that will be listening to this message. What I like about the treatment with Dr. Montesano is that you are very patient. I have a lot of questions. It was very educational. You answer a lot of my questions, because when you have injury like the one I have, it's very confusing. It's a lot of things in your head. It's a tough decision to make, like especially to let somebody come in and just like do any kind of procedure in your neck. But you made me very comfortable, very confident with what you're doing. And yes, since I got the shot, it's been much better. I'm being able to train much more. Like I'm even in my mind, it's much more relaxed and dealing with that thing every day. It was probably the best procedure, the best choice I could have ever done.
As I recall, we used 2 small needle sticks and then delivered the protein alpha-2 macroglobulin. Took about 5 minutes to do, and you're back training. And are you going to compete?
Yeah, I have 2 big competitions right now. I have I have 2 big competitions right now. I'm going for the ADCC trials, which is in Brazil, and in the last week of January in Brazil, and the first week of February in Rio. So back to back, I have 2 of the most important competitions in my life. And yeah, like especially right now at this point in my career, it's very important to be wise and choose what is the best procedure, because like every competition, every fight counts for me now. I really wanted to move on and start being a coach. I started like a promotion of events. So
now you're over in Naples, Florida, right? You came to me from Naples. So hopefully,
yes, I made an effort to, because I felt comfortable with you and everything. I really like, you were the one that explained and got me into this. So I made an effort to go all the way to your office, make sure I get the treatment with Dr. Montesano.
Well, very good, Marcel. Thank you very much for taking the time to talk to me, and hopefully I'll see you very soon on the mats.
Yes. Thank you so much, doctor. Yeah, I can't wait to train with you. I want you to come visit my school. So don't worry. Like if I end up like choking or something, you're gonna be able to take care of yourself, right?
I think so. I hope so. I hope so, Marcel.
You'll see.
I'm pretty. My defense is pretty good.
I know. I can argue with you about that. You have great defense.
All right, Marcel, thanks again for joining us today.
Thank you so much, guys. Have a great day.
So, Dr. Montesano, Marcel, he sounds like a special guy who obviously has benefited from your A2M injection treatment. Now, so let's talk about A2M, because I know that's something that Marcel had. He had a neck issue where he was able to benefit from that. What is A2M? How does it work? And what can you expect from undergoing a treatment like this?
A2M is alpha-2 macroglobulin, and it's a very potent, for lack of a better term, anti-inflammatory protein that your body makes, and it's called a tetramer. And one molecule of A2M, alpha-2 macroglobulin, can destroy 4 molecules of inflammatory cytokines or inflammatory proteins. So it's a very important protein that your liver makes. It's in your blood, but it's not in adequate concentrations in your body. So it has to be concentrated. We have to harvest it from the individual. We have to take the plasma. Now, in the plasma, there's over 400 proteins. Some of those are good for inflammation. Some of them are bad for inflammation. And that's why PRP has never been found to be effective treatment, because you're mixing all those proteins together. You have good proteins and bad proteins that you're injecting in the joints. So the listeners may have heard of people that treat with PRP, platelet-rich plasma. And the problem is there's so many proteins, there's no science behind it. There's over 30 papers that have been written on it, and not one of them concludes at the end that there's a positive effect. Now, offset that with A2M, which is one of those 400 proteins. There's a lot of science behind that. In fact, Brown University called A2M the master cleanup protein for arthritis. And basically what it does is it takes the inflammatory proteins, it attracts them to its core, and as I said, each molecule of A2M can attract 4 molecules to its core, and then the protein undergoes a configurational change and locks them in. They're not binding sites, they're attracting sites that it has, and it's like a Venus flytrap where it attracts these proteins into it close to its core, and then it changes its configuration, locks them there, and then we call it a suicide protein. It basically blows itself or destroys itself, and then your body absorbs all the little fragments that are left over. So this can be used to treat joints. It can be used to treat any joint in the body, really, even the small joints in the hand, the fingers. It can be used to treat the knee, the hip, the shoulder, the ankle, and we've used it to treat the spine as well. You can do injections right into the disc, or you can do injections into the joints in the back of the spine called the facet joints. Now I'm working with a very close friend of mine. He's actually a 14-year member of the Navy Special Warfare Developmental Team, which people call SEAL Team 6, but the official name is the first name I gave. And he's, obviously had a lot of situations where he had pain, and we all have in life for a variety of reasons. So we're looking at developing a non-prescription pain cream that will have A2M in it.
Wow, fantastic. So this would be by prescription, I assume? No, OTC, over the counter.
We may end up having a prescription strength of it, but we want to have an over-the-counter strength of it so that it's available to the general public.
Wow, that's fantastic.
It'll be right next to the other ointments that you find in the drugstore. Then there'll be our tubes, so it'll just be one other ointments or rubs that you can choose from.
It sounds almost miraculous, and I know that and we have talked before about and as you mentioned, the PRP treatment, which is probably more popular. A lot of people hearing this and that and not getting the real facts, but anecdotally thinking that, wow, this must be something special, but there's really not much regulation involved in that, and the use of the word PRP, for instance, is just kind of floated around pretty haphazardly.
I think that each individual, each patient has to do their own research, ask questions, ask what literature exists, go on the internet, find what literature exists, and then make a decision as to...
Forward to speaking with you again next week on next week's show.
You've been listening to The Spine Doc with world-renowned orthopedic surgeon Dr. Pasquale Montesano, MD. For more information, visit us on the web at spinedocs.org. That's SPINEDOCS.org. Or to make an appointment, call 866-79-DR-SPINE. Join us again next week for The Spine Doc, putting you on the road to better spine health. Spine health. Spine health.